Hi everyone, my name is Janelle and today we're talking about phencyclidine. So what is phencyclidine, or for short, PCP? PCP is a synthetic dissociative drug developed in the 1950s. It was originally developed to be used as anesthesia for surgeries, but was discontinued because it caused schizophrenia-like side effects. It is considered to be the most dangerous hallucinogen. PCP is also known as angel dust, killer weed, supergrass, ozone, rocket fuel, or animal tranquilizer. Hallucinogens cause distortion of one's perception of reality. It disrupts an individual's ability to think and communicate rationally, recognize reality. It can result in dangerous behavior and disrupt how the individual perceives time, motion, color, sound, and self. Dissociative drug is a type of compound where it causes users to feel detached from physical self. Methods of use. There are 4 methods that you can use PCP: orally, injected, snorted, or smoked. Orally, the PCP can be pressed into a tablet, or powder PCP can be capsulated so it can be swallowed. Liquid PCP can be injected into a body with a syringe, and this method of use produces the most rapid response. Powder PCP can be crushed and then snorted up by the nose. And then also to smoke PCP, powdered PCP can be sprinkled on marijuana and then smoked that way. Or liquid PCP can be dipped in with tobacco or marijuana wrapper, and then it could be smoked as well. Effects of PCP on the body. PCP disrupts functioning of receptors for the neurotransmitter glutamate. Glutamate plays a major role in cognition, such as perception of pain, learning, memory, and emotion. PCP also influences the action of the neurotransmitter dopamine. Dopamine causes the feeling of euphoria or rush associated with drug use. PCP also has physiological and psychological effects. Some physiological effects include hallucinations, depression, and anesthesia feeling. Psychological effects could be the person would feel invincible, like they have a lot of power and strength. Sometimes they feel paranoid or they display violent behavior. But all of these effects are dependent on how much of the drug you use. Some of the risks that are associated with PCP include addiction, tolerance, getting in trouble with the law because the drug is illegal, overdose, or even possibly death. The negative consequences of PCP is all dependent on how much of the drug that you take. There are short-term effects and long-term effects. The short-term effects depend on the amount of drugs that is taken and how it is administered into the body, and the long-term effects can develop after repeated use of PCP and can lead to building a tolerance. Some of the short-term effects include vision and hearing distortion, feeling as if you are floating, dissociation, anxiety, memory loss, numbness, body tremors, paranoia, and mild to intense euphoria. Long-term effects include speech difficulties, depression, social withdrawal and isolation, anxiety, memory loss, feeling suicidal, and development of withdrawal syndromes. Withdrawal symptoms can cause headaches, migraines, and/or sweats. If you know anyone that's struggling with a substance abuse problem, please refer them to the SAMHSA National Helpline. It is a free, confidential, and 24/7 line where they offer you treatment, referral, and information for anyone that is facing a mental disorder or substance use disorder. The number is listed below, and please pass this video along to anyone that may need help. Thank you so much for listening to my infomercial.